I'm Gareth and I'm the Senior Communications and Engagement Officer at Healthwatch Cumberland. So we're doing a project on men's mental health and it's all about getting people talking, what works for them to de-stress after a challenging day, what they struggle with, if they've ever accessed services and how they found them. So the reasoning behind the project is there is still a stigma attached to mental health, I think especially for men. There has been a lot of work done. You know, there's a lot more awareness raised these days, but there is still some barriers to be pushed through, especially around the kind of talking about the really harsh realities of it, rather than just a month out of the year saying it's good to be kind and it's good to talk, but then kind of falling back into not talking about things and certain subjects being a bit taboo. It's running literally until January, so there's plenty of time for people to get involved. Whatever comes from the project in terms of people's experiences of services and things that maybe could be improved that way, we'll be able to make recommendations for decision makers on how those services can be improved based on what real people have said. It's important for people to share their feedback because we can make recommendations based on their experiences of services, and that is going to improve services for the future generation. Rural isolation can be a barrier, not just because people live in a maybe more remote, isolated location and can't get to services, but also the kind of culture of those rural communities is often that you just crack on, and you know, if you've hurt yourself, you'll just tape it up and get back to work. We need to push through that a little bit. Another barrier as well is just how difficult it is sometimes to talk about what's going on with you and your mental health. A lot of people maybe they haven't been brought up that way to talk about that kind of thing, or they just don't want to seem weak, because they perceive that it's a weakness. And I would say another barrier is just the massive pressure that the system is under at the minute. A lot of people, they have actually reached out to services for help, and that help isn't getting there quickly enough. That's not a criticism. There's a massive pressure under the system at the minute, and a lot of those waiting times can't be avoided, but people's condition is actually getting worse in the time that it's taken for the support to be forthcoming. If you'd like to tell your story, email us on info@healthwatchcumberland.co.uk or call 0300 303 8567. Or the easiest way to get involved is by following the link in the description to fill out the online survey. Thank you. Let's make change together.